For a director of a hospital laboratory, it's essential to ensure that physicians have the most accurate and complete patient story in the EHR. But unstructured, non-interoperable health information often gets in the way. Unstructured documents like the fax prescription refill requests and test results that are piling up right now. Even for hospitals like mine that have attested to meaningful use stage 2 for clinical labs, 45% of results can still remain inaccessible from the structured environment of the EHR. And the process to get these results into the EHR is slow, expensive, and error-prone. Let's take a look. One staff member sorts through these faxes several times a day, picking out priority patients and calling the ordering physicians with the results. A second staff member keys the data into the EHR, often getting confused sorting through duplicates. A third team member spends more time validating those entries before they're committed to patient records. Lastly, 48 hours after the report arrived in your fax inbox, the original is sent to the records department, where it often takes up to 2 weeks to be scanned and linked to the patient's electronic record. So even if the data is in the EHR within 24 hours, physicians can't refer to the original if the test results appear abnormal. So let's review this timeline. It can take over 24 hours before information is available and in the EHR, and up to 10 days before the original can be cross-checked without having to retrieve it from the scanning room. And with so many moving parts that are dependent upon a thinly stretched team, the risk of test reporting errors increases. If all of this sounds familiar, then you've heard the physician's frustration and concern about delaying follow-up and putting patients at risk. But now, thanks to the intelligent clinical data capture solution from Extract Systems, there is a better way. With Extract Systems, we can automate this process. Unlike forms-based solutions, Extract can read these unstructured clinical documents like a trained clinician and automatically perform the steps necessary to populate the right data fields with the right data in your EHR. Using an intelligent clinical data analysis algorithm, it validates demographic data for each order, finds priority patients and moves them up in the queue, and reconciles the results with the orders. Then it deduplicates test results, locates and extracts test values, ranges, and flags, maps reference lab test codes to your test codes, and determines if test components are missing, all before even one staff member needs to do anything. After it analyzes the data, it presents the output to a verifier who uses the rapid verification interface to quickly tab through each field to visually verify that the captured data matches the original and to fill in the missing bits. Once verified, it outputs the data in the format your EHR requires. And lastly, it uploads the original document in your document management system and links it to the patient record, pretty much the way you'd expect it to, fast and accurate. And by eliminating manual data entry, what was a 2-week process can now happen in the time that it currently takes you to verify the data you're manually entering. And with only verification to do, you can focus on eliminating data entry errors and the potential for misdiagnosis and improper treatment. Thanks to Extract, you can provide a more complete and accurate patient story and deliver higher quality care. And nothing is more important. For more information, speak to an Extract Systems health information specialist today.